I knew about her condition, didn't know the severity of her condition. And that's when it was broken down to me, and that's when I kind of had a little meltdown.
In these last few months, the quality of life definitely decreased. But before, I was doing fine. I've had my condition for a very long time. It's been under control. So
It is very, very special story of Dr. Ajita. She's a 41-year-old practicing doctor from the Bahamas. See, she was suffering from chronic heart failure. That means the heart was failing over a period of years. But on a particular day, a couple of months ago, she had a sudden cardiac arrest. That means heart just stopped.
She just went into a cardiac arrest. And that's when she caught it hold in my hands.
there is where I lose all memory. So I don't know what happened there.
It happened luckily while she was in the hospital, and they could do the CPR and resuscitated her. But this happened a couple of times. Then only option at that time, because heart pumping was like 15%, that won't sustain like that for long. So in the doctor's hospital of the Bahamas, they put her on ECMO. But that is a temporary measure. Something to be done for to save her.
So we have a very strong team which has experience in ECMO and handling ECMO patients, both in neonates and adults. We've got a team which also does air ambulance retrievals. But this is the very first time that we have weaved both in, where we have shifted a patient on ECMO by air ambulance to Health City.
It is not a simple task to transfer on ECMO, because there are multiple tubes going directly into the heart. Then there is a machine to pump the blood, basically to support the heart and lungs. So while this transfer in the ground ambulance, then in the air ambulance, any kink or tilt or disconnection of any of these tubes can just lose the patient. So we put this left ventricular assist device on the next day. It was one of the complex heart surgeries that took almost 8 hours, and surgery went very well. That means we have to keep this artificial pump inside the chest and connecting that to the heart and making that heart pump into the main blood vessel. After the first time, she was put on ventilator. So over the next few days, she showed signs of improvement of all the organs, including the pump was working very well. And she was very weak. 2 weeks she was in the ICU, and after third week, we could send her home.
So I'm looking forward to completing my rehabilitation firstly. Being able to walk and run, like Dr. Manoy would say. Yeah. And then, I am also currently in a program, postgraduate program. So I also need to get back to doing that as well. And then also to my patients. So, yeah.
I think it has to have a way to get out there now for people to know the care that they will receive at Health City is undeniable, by all means, hands down, the best.
So the whole story shows how Health City as a hospital equipped with helping people with this advanced disease or situations like life-threatening situation like what happened to Dr. Ajita. Because what was the other option for her? Either heart transplant or putting this advanced pump into the heart. If these two options were not there, she will not survive. So it is like giving a second life for Dr. Ajita.
We have a saying between me and her, infinity. And that's what Health City gave us, our infinity vow.